So this is a wound assessment video for a wound dressing using sterile technique. Now before I go into the patient's room, what I will do, I would have looked at the last nursing notes. I would have looked what the nurse probably would have documented for the previous wound dressing. That would have been, the nurse had documented vital signs were stable, there were no drainage, the peri edges were dry, there were some redness, it was a little bit swollen, and there weren't really any signs of any infection. Also, I would have donned the correct PPE. That is, I would have practiced routine practice, and that is hand hygiene. So when before I enter the room, I'm going to do hand hygiene, and then I'm going to go ahead and speak to the patient. So I've done hand hygiene, and I entered the room. I'm talking to the patient. Hi, my name is Mark. I'm a student nurse here. I was asked to do your wound dressing. But before I start, can I have a look at your ID band? So I confirm the patient by using two identifiers, name and date of birth. And I'm going to explain the procedure to the patient. So Brad, I'm here today because I was asked to change your wound, and we need to do that on a daily basis to observe the wound to see if there's any developing infections or anything like that, and we also need to clean it to make sure that it's healing well. Okay, and I've got the patient consent to go ahead and do it. Now before I start doing anything, would you like to use the washroom? Is the temperature and the lighting in here fine? Perfect. Are you in any pain? No? Okay, and do you have any allergies, like allergies to latex or adhesive tapes? Patient does not have any allergies. So I'm going to go ahead. I got my supplies already set up and before coming in, so I got that already. So the patient's given me consent, so I'm going to go ahead and I'm going to provide some privacy. And then, after provide the patient some privacy, I'm probably going to give some health teaching, which I've already been given, and throughout this, I'll probably provide the patient with some health teaching as well. So Brad, we're going to use sterile technique to clean your wound so that we prevent risk of contamination, and that involves me not touching certain things, and then touching the sterile field, which I'll discuss with you later on, okay? Alright, so I'm just going to set up my garbage bag just between me and the patient, my work field. I'm going to raise this up to my waist and lower, actually raise the bed up. And then I'm going to put my blue sheet right where the wound is. I'm going to do hand hygiene, I'm going to don clean gloves, and I'm going to have a look at the wound. Now I'm going to remove the dressing one layer at a time, and I'm going to note any findings. And I assess the patient. Patient is able to cooperate, so I don't need a second nurse to assist me. This is a single incision. So I've removed the dressing, and there is a pinkish sersanguinous drainage on the incision here. So I'm just going to throw that out. And then I'm looking at the characteristics of the wound, and there is no redness, there's no swelling, there's no drainage, the skin is intact, the staples are intact, there isn't any sign of any infection. So now that I've have a look at that, I can doff my gloves. I'm just going to take that off, throw it out, perform hand hygiene, and then I'm going to go ahead and get all my supplies. They're ready. I'm going to open my sterile tray. So this goes away, open the edges. Now I'm holding it within a 1-inch border. I'm going to slip my finger under here and just take this out. I'm going to open it. So I'm just going to move this around like that. Just going to turn it. I'm going to take everything out. And this is the shiny side, so it's okay for me to hold it. And I'm going to use that. This is a second sterile field, so I'm going to use it for my here and create another sterile field. And then I'm gonna add additional supplies. I'm adding a 2x2 gauze, some extras. I'm gonna put some more here. I'm gonna throw this out in the garbage. I'm gonna put some 2x2s, I'm gonna peel it. I'm gonna take one out, add it here. I'm gonna probably take another one, add it there. Put this back, I'm gonna throw that out. And I'm gonna take my saline, look at the expiration date, put my hand over the label, open it. I'm gonna pour some out, and then I'm gonna pour some in the sterile container. I'm gonna cap this and put it back down. And now that I'm done with that, I'm gonna do hand hygiene, and then I'm going to don my sterile gloves. So I can hold the inside of the gloves and just put it on. And then with the glove, I can just put my finger underneath and just slide this through. I'm gonna adjust that really quickly. There we go. So now it's all set. And I'm gonna just quickly remove that from the table just to create more space. And now that I have my solution here, I'm just gonna soak that. I'm gonna make it into a dumpling. I'm gonna squeeze it out. I'm gonna use my sterile forcep, and I'm going to clean the wound from least contaminated to the most. That's from the middle, top to bottom. And I'm gonna put that in my garbage. I'm gonna do this again for another one. I'm making like a dumpling. And then I'm going to clean again. Side, garbage. And we're gonna do another one. Squeeze it. Use my sterile forceps. Other side, garbage. So both sides. And then I'm just gonna put this onto my field. Now I'm gonna take a dry sterile gauze and I'm going to pat from top to bottom. So I just wanna make sure that I pat dry. And Brad, how are you doing there? He's doing fine. So Brad, I'm doing all of this because I have my sterile gloves. I have to make sure that I don't touch anything outside because there's risk of contaminating the wound. Again, if I do that, then there's a high risk of you getting an infection. So once I've done that, I'm going to cover the wound with another sterile gauze, and I'm gonna leave it like that. And then I'm going to, at this stage, I can either take my gloves off or I can just use the tape like that. So I'm just gonna keep it on. I'll put the date on it, and then I'm going to tape it to secure the dressing. So I've done that. I've done 3 layers and I've secured the dressing. So I'm gonna take my gloves off and I'm gonna do hand hygiene right after. Okay, and Brad, how are you feeling? You feeling okay? So the patient is feeling fine. The patient tolerated this very well. Next, what I'll do, I will document any findings. I will document the patient comfort, tolerance to the procedure. I'm going to document the characteristics of the wound, the items used for the wound dressing, including the gauze, the solution, everything else that's been used. And also I'm going to document or report any abnormal findings or any signs of any infection. And that brings us to the end, so I'll just lower back the bed and I'm going to clean up everything and then perform hand hygiene, and that is the end of the skill. Thank you.